Today, researchers at Loma University Medical Center's Proton Treatment Center have announced the effectiveness of a new weapon against early-stage breast cancer, proton beam therapy. The results of a Phase 2 clinical trial indicate that partial breast radiotherapy delivered with proton beam appears to provide excellent disease control within the breast, with minimal risk of side effects.
Proton would be a nice tool to use for such treatment because it really lets us radiate just that specific area. And by doing it that way, then we should be able to minimize, or in many cases eliminate, this treatment or exposure of the lung and the heart, and eliminate complications there.
Today, most women diagnosed with early breast cancer would undergo surgery to remove the tumor from the breast. Radiation treatment is then performed over the entire breast. The study looked at treatment results by using proton beam radiation to treat just the area where the tumor was located, instead of the whole breast.
Standard radiation that's available at pretty much all radiation centers would be treatment with what we call photons, or X-ray treatment. And the difference between kind of regular radiation or photons and proton radiation is that X-rays or photons tend to go all the way through, meaning that there's no stopping to the beam. So when you aim that beam at the patient, it penetrates from skin to skin, in one side, out the other. What protons will do is they will penetrate to a certain depth and then stop. And the majority of the energy deposited happens just before the beam stops. And we can control where that stopping happens. We can make the beam go to a certain depth and stop, thus making the dose of radiation actually get deposited where we want it to, instead of kind of traveling all the way through the body.
Apart from being less toxic to the patient, the treatment reduces the amount of radiation time to 2 weeks instead of the typical 7 weeks.
When they do proton radiation, because it's targeted to just the area where the lumpectomy was performed, first of all, it spares the rest of the breast, and secondly, it takes only 10 days instead of 5 to 7 weeks, so the women are not committed to traveling back and forth from their home to a radiation facility for over a month.
I was able to go back to work. I didn't feel tired. I mean, it was fine. It was just being there for 30 minutes and going back to work. If anybody's going to be diagnosed with breast cancer, I mean, this was like the easiest journey I've ever had in my life.
The results we have so far, and you realize this is an ongoing thing, we did an analysis just recently on the initial 50 patients we enrolled, and we have enough follow-up on those patients to have data that extends out to 5 years. And what we've seen is there has been, of those 50 patients, at 5 years of time, there's been only one patient who's had a recurrence in the breast. So it seems that, and that one patient, that recurrence was not at the original tumor site. It was at a separate area within the breast. So it more than likely was a developed new breast cancer, not a recurrence of the original ones.
Last year, the study completed enrollment of 100 patients, and a third phase of the trial is planned. Proton therapy is currently available for breast cancer patients at the James M. Slater, MD, Proton Treatment and Research Center at Loma Linda University Medical Center.